Madam Speaker, Mr. President, we're live.
Okay, I just couldn't see him, so, okay. Good morning, everyone. I'm going to start. So we have a very special guest this morning. Yesterday, the health department reported 2,000 more Marylanders had tested positive for COVID-19. Our positivity rate stands at nearly 7%, and another 26 Marylanders have died from the virus. Despite extremely positive news from vaccine trials, we are still facing what President-elect Biden referred to as a dark winter. Hearing a nurse from South Dakota describe dying COVID-19 patients who still don't believe the virus is real is heartbreaking and disturbing. We need to stand together and continue to communicate the seriousness of this situation to all Marylanders. Over the past several days, Governor Hogan has taken a variety of steps to slow the virus, including limiting indoor gatherings, closing bars and restaurants at 10 p.m., reducing all retail establishments to 50% capacity, issuing new travel warnings, pausing elective procedures at hospitals, limiting visitation at nursing homes and hospitals, and increasing rapid response teams and testing at nursing homes. I was also pleased to see many of our local leaders take additional steps to further slow the transmission of the virus. It is clear that help from the federal government, either in the form of stimulus or a national COVID-19 strategy, won't come until the next administration is in office. So it is up to us to keep our citizens safe, to remind them that the virus is indeed real, and provide them with the support to keep their families afloat. We cannot keep our economy moving forward and our revenues up if we do not get control of this virus. Most of our offices are still receiving calls from tens of thousands of Marylanders whose unemployment benefit cases are still not resolved. I want to thank you and your legislative staff for your hard work. The Department of Labor needs to resolve these cases before the holidays. I know they are trying, but we must do better. Before I turn it over to President Ferguson for a few words and to introduce our health department officials, I want to thank former delegate and now Secretary Bobby Neal for his service to our state. Mr. President.
Thank you, Madam Speaker. Good morning. Good morning, members of the work group, members from the House and the Senate. I want to echo entirely the Speaker's remarks. I think they were fully on point and endorse entirely. In introducing Secretary Neal and Dr. Chan, I do also want to take a quick moment to thank former Senator Secretary and now Secretary Neal, someone that has respect from both sides of the aisle, because he sat on both sides of the aisle, a bipartisan consensus builder, somebody that has come back into public service after over 40 years, who doesn't know how to say no, wants to find a way to solve problems. Want to thank you for your leadership during this. This has been an unbelievably trying time, and it's folks like you who have served the people of Maryland with such distinction and honor, that we are thankful for your service. And if this is the last hearing we have before your December 1st retirement, a deep and genuine thank you for your service. And with that, I will hand the mic over for you to give us an update during this trying time.
Madam Speaker and Mr. President, thank you for your very kind words. I have to say that the 12 happiest years of my life were in the House of Delegates. We had a lot of fun. We learned a lot, and we didn't take each other very seriously. The next 6 happiest years of my life was in the Senate of Maryland, where I tried to negotiate around Mike Miller, and that was an art rather than a science. These last 3 years, though trying, have been very rewarding, and I simply do not have the strength and vitality to continue, so you have to know when to say when. To get to the briefing, we're at a point where help is not coming from the federal government fast enough. We know that vaccines are in the offing, but not right away, so we're left to our own. And simply put, all Marylanders must take individual action to slow the spread of this vaccine. The health department can't do it. The Senate of Maryland can't do it. The House of Delegates can't do it. Individual people acting on their own are the only people can do it. How do they do it? Well, if you want to avoid a lockdown, and lots of states are headed that way, wear a mask, keep your distance, wash your hands. If you get a call from contact tracing, answer it and give them the information they require. Another thing that you can do that's not on my list is consciously curtail your activities. Reduce the number of times that you go shopping. Reduce the number of times that you're outside of the house. Just consciously. And if it's 15 or 20%, if everybody does that, that's going to make a big difference. And in addition, as the holiday season approaches, all Marylanders are strongly advised against traveling to any state with a positivity rate above 10% or a state with average case rates above 20 per 100,000. I think that's just about everywhere. So my advice would be to stay home and keep your gatherings to an absolute minimum. Ladies and gentlemen, I think we have a video that I'd like to play with your permission. Would the staff please hit the button?
We wash and we pump. We put on, we pull up. We test and we trace. We keep our space. We keep on doing things that almost feel normal to keep each other safe. And you know what? That is normal. Keep on slowing the spread, Maryland. We wash.
Thank you for indulging us. We're trying to reach Marylanders wherever they are to try to keep this message in front of them. The next slide is the roadmap to recovery. Some key highlights from the 4 pillars include testing. We are just short of 4 million PCR tests since the beginning of the pandemic. We are now averaging a testing volume of approximately 30,000 tests a day. Contact tracing. Since the launch of the state's contact tracing system in June, we have successfully reached and interviewed over 64,000 cases and 85,000 contacts. Today we have approximately 1,400 contact tracers. PPE, we've distributed approximately 85 million pieces, with requests continue to be fulfilled as we speak. We are making procurements so that we keep our inventories up, so that we don't run short. It's one of my biggest worries, because when you have 40, 42, 45 states in trouble, it's going to test supply chains, so we're trying to stay ahead of that. And last but not least, our hospital surge capacity. This morning, we are up to 1,144 people in the hospital, 874 in acute care and 270 in ICUs. Just as a reference point, our high water mark this spring was 1,711, so we're well on our way. We're trying to stay ahead of that. Yeah. So those surge beds are very important. We're going to be spending some time during this morning's presentation sharing more about our response to the recent surge in cases and its impact on hospitals and healthcare itself. So to continue our presentation, I'd now like to turn it over to Dr. Chan. And again, thank you so very much for your kind words.
Thank you, Secretary Neal, and good morning to Madam Speaker, Mr. President, and members of the committee. I'm glad to be with you this morning, although certainly not glad to be reporting out on the numbers that Secretary Neal has alluded to. As you can see from this map, this map demonstrates the 7-day average case rate by county across the state. The overall average positivity rate, 7-day average positivity rate for Maryland now exceeds 5%. It is at 6.8 this morning, and that went above 5% for the first time since June, just a few weeks ago on November 8th. When you look at our 7-day average average case rate across the state, we are currently at 31 cases per 100,000 as of today. And if you look across the state, there are 10 counties that are above 25 cases per 100,000. Including in Western Maryland, where early on in the pandemic, in the first and the second waves of the pandemic, they did not see as great of an impact, but they're certainly experiencing that now, unfortunately, and we're also seeing similar rates in the counties in surrounding jurisdictions in Pennsylvania and West Virginia out in that region. And so I think that that's important to recognize that, this is a trend that even across the country, that the greater impact that hadn't been there before, we're seeing it in rural areas. And so the state is supporting the work and the needs out in those rural areas, and with testing and contact tracing and other supports as needed. So next slide. So, of course, as we see the increase in cases in the community, we're also seeing that impact, unfortunately, in our hospitals as well. And so this graph has a number of different pieces of information. And so the black line indicates the number of daily reported cases, and that was as of the 16th. And so in the last couple of days, we've had and this is average, 7-day average reported number of cases. And the red line is the number of hospitalized patients, and as of this morning, it was 1144. With the bars representing what we are currently occupying in terms of total occupancy in medical surge and in ICU beds, both COVID and non-COVID. Right now, with the medical surge beds, our COVID cases are occupying approximately 14% of the total staffed med surge capacity in the state. But obviously, we've been having a number of conversations with our hospital partners, hospital leadership, the Maryland Hospital Association, as we are seeing the impacts across the country on many other hospital systems. We have been very much prepared from the beginning under Secretary Neal and the governor's leadership to ensure that we have a much greater hospital surge capacity, and we fortunately have not had to use it to any great extent up until now, but some of the actions that we have taken in recent weeks is to make sure that we are prepared to use those and can access those easily if we need to do so. And so the total number of hospitalizations that you see in that red line, that has doubled since the beginning of November in terms of total number of hospitalized COVID patients. So we continue to monitor that and have frequent discussions with our hospital partners on how we might be able to mitigate that and how to care for patients. But, we cannot emphasize enough that that this impact of COVID cases on our hospital capacity is not just about caring for individuals with COVID disease, but making sure that our hospitals have enough capacity to care for all of the other ailments that are non-COVID, so people who have trauma, heart attacks, strokes, and other important, critical, life-saving medical care. And so it is important that our hospitals are not overwhelmed to be able to care for all of the healthcare needs, the emergent and urgent healthcare needs of our citizens. So, and what we're seeing in this surge is a little bit different than what we saw in the spring. In the springtime, we were nearing the tail end of the flu season, and here we're entering into the flu season. And, now we're 8-9 months into the pandemic, and what we're seeing and hearing from our communities and our partners is that there is, and even our healthcare, unfortunately, is a sense of pandemic fatigue, that people are tired of practicing and wearing masks and washing their hands. And certainly as the cold weather, and today's we've had a cold front this week, more people are indoors versus outdoors, and so there's really a confluence of factors that's coming together now that's driving the increase not only in Maryland but across the country. I will say that we are fortunate that Maryland, even though we're seeing our increases, we have been preparing for months now for this. We knew that this was a possibility. And even at 30 cases per 100,000, we know that we still remain a little better than other states. I was just looking at the CDC tracker this morning, and, unfortunately, I think the speaker may have mentioned South Dakota or North Dakota, but North Dakota is at 180 cases per 100,000 today. And so we certainly are concerned about our neighbors in South Dakota, and are really rapidly trying to make sure that all of our efforts here to protect our neighbors here in Maryland are ramped up rapidly. So next slide. So with that, because of the level of community spread, there's really several tactics that the governor is taking to protect Marylanders. And so the first is we are beginning to institute community mitigation measures to try to reduce the amount of ability of the public to gather in public spaces. So last week we instituted a 50% capacity limit for restaurants and bars, and this week we are instituting a 10 p.m. closure for bars and restaurants, except for carry-out and delivery. And so that means that individuals who are dining in a bar or restaurant must be out of that facility by 10 p.m. In addition, we are instituting a 50% capacity for all retail and religious facilities. Religious facilities was at 75% previously, and I believe retail as well. In addition, while we have been able to, in the earlier part of the fall, been able to open up outdoor sporting venues to greater capacity, we will now be limiting that capacity at the outdoor sporting venues to 50% or 250 people, whichever is lesser. Next slide. So, and that's on the community front. Importantly, as we showed in the hospital surge information, and we're seeing these impacts regionally as well, that there are some challenges because of the increase in numbers of cases out in Western Maryland that we are working very closely with the hospital systems there on. But we want to be sure that we are as protective as we can. And so effective immediately, we are prohibiting hospital visitation until further notice, and this will prevent the unnecessary ingress of individuals who may be infected with COVID-19 but are asymptomatic. We do have exceptions, of course, for end-of-life care or individuals who are minors to have their parents or guardians with them, and obstetrics visits as well, related visits, and of course support persons for individuals with disabilities are important exceptions that we're making to that, but we really want to limit visitation in hospitals. In addition, it is important that we are increasing the hospital's authority to transfer COVID-19 positive patients that either present to the emergency department or are admitted as inpatients, but perhaps are stabilized and can be then transferred to alternate care sites and other healthcare settings. MIMS is going to be taking the lead on facilitating such transfers. They are pulling together a critical care coordination center that will help to facilitate these transfers between hospitals as well as to alternate care sites that the state has stood up in different regions. In addition, COVID-19 negative patients may also be able to be transferred to other healthcare settings. Now, these are provisions that allow us to maximize the use of the expertise in different hospitals to the maximum capacity. This is a system that we are setting up that is very similar and very much based on the shock trauma system, in which individuals are triaged and sent to the appropriate facility that can most appropriately meet their needs depending on their level of acuity and how stable they are. And so Dr. Ted Delbridge, who's the director of MIMS, is working closely with the hospitals and the Maryland Department of Health to stand up this coordination and facilitation center. So we want to be able to give the hospital the flexibility to address capacity issues and to utilize these alternate care sites that we have set up. But again, we have been fortunate that we have not needed to use them, but we want to be prepared so that we can easily access them if some of the critical capacity bed needs within our existing hospital sites are approaching their limits. So in addition to that, we certainly want to ensure that patients get the best care possible, and we'll make every effort possible to make sure that individuals who are transferred are as close to their home or to the hospital that they were in as we can. So next slide, please. Oh, wait, let me talk a little bit about, about elective procedures as well. Right now, we are not intending to close down for the moment all elective procedures as we did in the springtime. There were consequences to that we want to avoid. I think that in the springtime, we were very much in a different place than we are now, in that we do have the additional bed surge capacity that we didn't have in March and April. And so there was a need to close down all elective procedures at that time. While there were consequences because elective procedures are of varying types, and certainly some are, while they may not be emergency procedures, some of them are still semi-urgent and really important for individuals' health and well-being that might be related to oncology or obstetrics or orthopedic-related surgeries that will impact people's health and well-being. And many of the hospitals have already instituted criteria to select which patients should, to balance patient risk in terms of both COVID-19 risks as well as risks related to their underlying conditions. And so we did issue last week an advisory to clinicians to take another look and assess individuals' risk of potentially being intubated for extended periods of time or needing prolonged hospitalization or post-hospitalization or post-procedure nursing home stay. And if those criteria are considerations for that particular individual, to consider whether or not a delay in that elective procedure is warranted. So, but all of the hospitals have instituted plans to begin to slowly delay certain elective procedures as long as it does not have a significant impact on the patient's health and or on the overall bed capacity. So next slide, please. So in terms of of nursing homes, we of course, in the spring saw that the impact on nursing home populations was tremendous, and we're beginning to see additional slight increase in the number of admissions as well coming from nursing homes. And so as of this week, we are instituting a testing surge, which includes a twice-weekly testing for all staff at Maryland nursing homes, using a combination of either PCR or a point-of-care test. We also recommend that residents be tested at least once a week. And some of this is because we were finding that even with the testing that had been done in nursing homes, once we found one individual who was tested, that led to a round of universal testing, that we were finding many, many more cases who were asymptomatic in nursing homes. And so because of the community spread, we want to be sure to identify individuals who may be positive but asymptomatic as early as we can. To assist with this testing goal, which we know is very ambitious but very critical, the state will be providing every nursing home with sufficient supplies of the Abbott Binax Now point-of-care test to test the staff twice a week from the end of this week until the end of the year. And if a nursing home has the Becton Dickinson testing system, they'll be given the option to purchase additional point-of-care cartridges from us. So in addition, we're instituting additional limits on visitation, particularly requiring that visitors prior to coming in, that they have a negative test 72 hours before their visit. There are no changes in outdoor visitation, although, of course, with the weather, it is a consideration. And any nursing home who has an outbreak, which is defined by either a single positive staff or resident, should not have any visitation as well. Next slide. So with PPE, as noted to date, we have distributed approximately 85 million PPE, and hold on a second. And what this table shows is that basically it's the burn rate, and what we currently have at the state stockpile, what we anticipate or what we're estimating the current burn rate is across the state, and then it's a simple calculation of dividing the inventory by what the burn rate is to get to the approximate days on hand. We also have anticipated burn rates should we reach near where we were in the spring at around 1,800, I think it was about 1,700 hospitalizations, and what the burn rate there would be. As you're aware, last week, Secretary Brinkley and Secretary Neal issued a letter to county executives across the state advising them that if they have any remaining CARES funding, to invest it in their own local stockpile to ensure that we have sufficient PPE for this coming surge, or the surge that we're in right now. And so the state stockpile and local stockpiles are supplies of last resort, and we are also encouraging our hospital and nursing home partners to ensure that they have sufficient supplies to manage patients with COVID or with other infectious diseases like flu. Next slide, please. Wanted to touch on some other aspects of the work that we're doing. So with contact tracing, with COVID alert, that was issued or released last week, so just a little over a week ago now. And as of yesterday, we had about 1 million people already sign up. That's about 16% of Maryland's population. And so if you haven't already, if you have an iPhone or an Android, look for MD COVID Alert. With the Apple phones, you should be able to just enable it in your operating system. And so this will help to identify and if you are a close contact with someone who is tested positive. So it is another important tool in our tool belt. Next slide, please. So MD COVID Alert, again, it just augments our traditional contact tracing, and we continue to reach many Marylanders through our efforts. We have over 1,400 contact tracers and are continuing to hire. And so it's important that individuals who are called by MD COVID link, that they answer the phone, because this is important information and another way that people can participate to protect their neighbors and their family and friends. To date, we have had over 85,000 cases entered into the system, and about 77% of cases who have a phone number have been interviewed. What we are noting over the last month, and of course this was somewhat expected with some of the colder weather, but we are seeing an increasing trend in the number of people who are reporting attending gatherings, including family gatherings, and also high-risk locations like retail and indoor dining. Next slide. You've already seen one aspect of our Masks on Maryland campaign, and we have various components to it, including distributing masks to the public at testing sites and other locations. And we want to emphasize again and again that masks, while it's not something that people are accustomed to, right now it has to become a way of life, because it is how we're going to combat, an important tool that we can combat this pandemic and carry on with our daily business and all of the things that we want to all be able to do for ourselves and our family. So we want to continue to message that out. So last, as I close, next slide. We would encourage everyone, again, keep your mask on, wear a mask when you're going out in public at any point in time. Practice physical distancing. With the holidays coming up, we have Thanksgiving next week, and it is a time when, even for me, I usually come together with my family, my in-laws, extended family, and we are not doing that this year. So if that is something that families can practice and celebrate in a different way, we would certainly advise to limit the number of social gatherings that they attend. Wash hands, answer the call, and that's with our contact tracers. And I would add at the end, we are in flu season. It is not too late. Please get a flu shot. So I will close there, Madam President, Mr. Speaker, and we are happy to answer any questions.
Thank you, Madam Deputy, Acting Deputy Secretary, Dr. Chan, we appreciate, and Secretary Neal. We do have several questions. It looks like Chair of our Finance Committee, Senator Kelly.
Thank you very much, Mr. President, and thanks to you, Dr. Chan. I am grateful for the new hospital visitation exceptions. I hope that works out well. But I have a concern about where the costs will be borne for this nice new stockpile of PPE that you have, because the nursing homes and assisted living, but especially nursing homes, have been battling with you guys regarding where those costs will be borne, since they really are practically broke in many cases. I additionally was wondering, with regard to the transfers that you're going to have now to alternate care sites, that we don't overwhelm small assisted livings. And I know that's the cheapest place to send people, and those are Medicaid funded rather than Medicare funded. But could you talk to us a bit about what the cost structure is going to be for the new PPE as it becomes necessary to distribute it? Is this cost going to be borne by the state at large, or shared, or will it be totally on the backs of the nursing homes and the assisted living? And with regard to these transfers, are we sure that people are going to be in safe and welcoming and life-affirming places, because the cheapest thing would be assisted living. And as you know, we don't really visit them, inspect them. There are almost no regs. We don't know what they might face if they go there. So I know you've got problems that honor of your making, but I'm just concerned about what your plans are regarding these two new protocols. Thank you.
Thank you, Senator Kelly. Those are really excellent questions. So let me address the PPE issue first and foremost. So since the beginning of the pandemic, the state and local governments have been purchasing supplies of PPE. Of course, we know early on it was a major national issue with the shortages of PPE, where we were really combating really other states to get the supplies that we need, which was not the position we wanted to be in. Since the summer and even into the fall, the commercial supply chain has vastly improved. And so with that, our continued communications through the summer and the fall, and even up to now, to skilled nursing facilities or to nursing homes, as well as to hospitals, has been that, you know, they need to also begin to stockpile. However, with the dollars that we have received and the remaining dollars we have from CARES funding, the federal CARES funding, which we did use in large part to purchase PPE, we're needing to spend that down by the end of December, and so that is where the request was made to locals for any remaining CARES funds that they have to purchase PPE, and we provided all of the local counties with information about burn rates, and even provided them access to existing state contracts if it would make the process easier for them. The state also has been using our remaining CARES dollars to be able to purchase PPE. While we would encourage all of our private healthcare partners and nursing homes and hospitals and others to purchase their own supply, we are the supplier of last resort, and so if they have a dire need, they should go to their local health department to request supplies. In terms of your second question, in terms of patient transfers, when I talk about alternate care sites, I'm actually talking about the surge capacity that we have stood up in locations around the state, such as in Laurel Hospital, in Tacoma Park, and the Baltimore Convention Center Field Hospital, as an example, that are actually certified as hospitals. So we are not looking to transfer individuals to settings like assisted living. So this would be if, for example, an individual who comes to an emergency department and has some mild symptoms, and that particular hospital may be near capacity, we have now the ability to be able to transfer that individual to another facility that is able to manage them in a hospitalized setting. So I hope that addresses your concerns.
Oh, Madam Speaker, I think you may be on mute.
There you go. Vice Chair Jackson.
Thank you, Madam Speaker. Mr. President, thank you, Secretary Neal, for your service. Dr. Chan, thank you for your presentation. In October, I believe it was, all frontline employees, and to narrow it down, in Prince George's County, I work for Office of Homeland Security, and the public safety officials in the county or employees were required to be tested. So with the resurgence of the pandemic, does the Department of Health foresee frontline employees being mandatory to be mandated to get tested again? And if so, where do those resources come from? And when it occurred in Prince George's County for the mandatory employees, it came through the health department. So should we be looking forward to that in the near future?
Thank you for your question. Let me clarify, because I think the connection, at least for me, cut out. Are you asking about public safety employees? Are you talking about corrections employees?
No. Actually, I'm actually for anyone in the public safety arena or healthcare arena that are frontline employees. I happen to work for a public safety agency in my county, but I guess the question is, will we be requiring those folks that are in direct contact with the public to be tested? And if so, is that the funding of that coming through the health department or through the local counties and city?
So, thank you. Thank you for the clarification. I appreciate that. The state health department has not required the serial testing of public safety and healthcare providers outside of skilled nursing or nursing home facilities. So that may have come from the county itself, but we can certainly circle back to the county to ask that question as well.
Thank you. And if you could provide the entire work group, we'd appreciate that. This is obviously affecting us all. And thank you all. Thank you, Madam Speaker.
I understand. Thank you. I think that may have been a county-specific policy, but we will double check and let you know. Thank you.
Thanks.
Thank you. Next, we have the Chair of the Budget and Taxation Committee, Senator Guy Gazzoni.
Thank you, Mr. President. Doctor, as much as we all are encouraging folks to limit travel and minimize their celebrations for Thanksgiving, what can you tell us about enhanced testing right after the week of Thanksgiving? And what are our overall plans for dealing with what could easily be a surge?
Our advisory, of course, that was put out last week was to advise people to not travel, particularly to states with high case rates, but also to get tested before they come back, if at all possible. Now, it is an advisory and not an order for many of the reasons that the governor has already outlined that it would be very difficult for enforcement purposes. However, recognizing that individuals will likely, many are still planning probably to travel, we would urge individuals to take the maximum precautions possible and to maximize physical distancing and to try to not gather in groups greater than 10 if at all possible. In terms of our ability to manage cases as they come back, that is what we're preparing for now. I think that some of the tools that we have recently employed, such as the ENX system for contact notification, we're augmenting our contact tracing efforts. But it really does come down to that individuals have to understand what their risks are and have to mitigate those risks to the maximum extent possible. We're really urging every single Marylander to help us, that we cannot do this alone.
So I think part of my question would be sort of along the lines of, will you be increasing testing hours or locations, or is there what sort of physical enhancements might the department be taking?
We have over 220 sites, both public and private, across the state. As of this time, we are not expecting to change hours, but we will certainly consider that. We know that the demand across the state is increasing, that we're hearing about, which I think is good, and we have enough tests to be able to accommodate those individuals, but if we need to, we certainly will accommodate hours or look at expanding hours and such, but appreciate that thought, and we will make that determination assessment. We do not, of course, run and operate all of the testing sites around the state, and some of it is dependent on individuals, the private operators. But for the sites that we coordinate and or operate in conjunction with locals, we know that they're shifting hours, and we will do the same if the demand is there.
Thank you, Doctor. Thank you, Mr. President.
Majority Leader Lukey.
Thank you, Madam Speaker. Dr. Chan, Secretary Neal, thank you for your presentations. Dr. Chan, I'm deeply concerned about the significant outbreak we've seen in Western Maryland. Allegheny County, we're seeing per capita rates that are like close to 4 times the state rate. According to some of the websites out there that report on COVID metrics, there are capacity issues at some of the hospitals out there. So I'm curious if you could tell us more, first of all, about whether we have a sense of what's leading to that significant outbreak. Is it just the general issues we've seen, or are there relationships with some of the institutions out there, such as the prisons? And then secondarily, what the situation looks like in terms of hospital capacity, surge capacity, and whether there are relationships with West Virginia and Pennsylvania to share any hospital space if that becomes necessary.
Thank you, Delegate. And we hear, of course, that the Maryland Department of Health share your concerns, and I have been in very close contact with the health officer in Allegheny County over the last several weeks as we have seen the numbers increase. And some of it started with some localized outbreaks involving nursing homes and the university, Frostburg, and others. But really, I think that what we saw out there was more about community spread and household contacts and individuals congregating and perhaps not as vigilant. And I think this is happening across the state as well, but not as vigilant in mask wearing and physical distancing. And so that, I think, is a major contributor. However, the impact to the hospitals is no small thing, as you noted, and the hospital up there in Allegheny County in Cumberland is affiliated with the University of Pittsburgh, as you well know, and I know Dr. Delbridge was just out there earlier this week, maybe I think yesterday or the day before, to assess the situation and see what we could do as a state to coordinate with our hospitals. Of course, it would be with the parent, or if you will, organization at the University of Pittsburgh. I don't know what specific coordination there may have been with West Virginia in particular, but certainly, as I noted earlier, it's really that whole region that's impacted, and that individuals that are coming to the hospital there in Cumberland certainly are not just from Maryland, but it's a very, it's that tri-state area that's impacting that, as you well know. So we're gearing up as many of the resources as we can, and that is why we instituted this order to allow for within important clinical parameters to safely transfer patients to other facilities to be able to care for them. So that work is in process.
Thank you. And members, we do have to stop at 11 today. So just as these final questions come, if folks could keep them pointed, and if there are follow-up afterwards, we can make sure that the committee receives that information. Next up, we have President Pro Tem Melanie Griffith.
Thank you, Mr. President, Madam Speaker, Secretary Neal. Dr. Chen, my question is very brief, and thank you for your presentation. Just wanting to get a sense if you have an update on the status of our Medical Reserve Corps. I know that our providers are exhausted and have been dealing with this for some time. So can you update us on how we're doing with the Volunteer Reserve Corps and any other relief that we have for our healthcare workers?
That's a very important question. I don't have the numbers right now, but we'll certainly follow up with you. It has been, I think, very challenging to be able to tap into Medical Reserve Corps for some of the needs that we're seeing in hospital and nursing home settings. And some of it that we were able to accommodate in the springtime was because Maryland was experiencing a surge at that point when many, many other states, like in the Midwest and Southwest, were not. And so we were able to tap into staffing pools that could, travelers, if you will, that could come into the state to supplement our staff. Now, if you look on the website, on the CDC website, you see where, the vast majority of states are greatly impacted. And again, the vast majority are more impacted even than Maryland. And so the staffing pools across the country that we have been able to tap into before are much more limited. And so it does present significant challenges for Maryland at this time. However, at least, and I neglected to talk about this, but with our technical assistance teams that have been going out to nursing homes, we are also standing up and augmenting their capacity to be able to provide some at least interim relief for staffing in nursing homes. In addition, we are discussing with hospitals ways that we can maximize staffing pools, looking at different staffing ratios needed, and other potential, augmentation of crisis staffing models that we may need to implement if our numbers worsen. So all of those are being discussed, and very much appreciate your attention to this very important topic.
Thank you, Dr. Chan, Mr. President.
HGO Vice Chair, Delegate Pena Melnick.
Sorry, it's muting me. Sorry about that. Good morning, Madam Speaker, Mr. President. I have a question. Basically, my question is that we know that the numbers are going to worsen. You see the picture, you see what's happening in other states as well. Have you considered intermittent lockdowns? For example, before the holiday, Thanksgiving, lockdown for a week. Before Christmas, lockdown for a week, because it will alleviate the impact on the hospitals and we won't lose more people. In addition to that, have you considered doubling down the testing in communities of color, the Black and brown communities that are the most impacted, and we could see the numbers in the next few weeks as well? Thank you, Madam Speaker.
Sure.
Thank you, Delegate, for that question. And so I think that the governor is considering all options as we are looking daily at the metrics and the impacts on the hospitals, and in particular concern, as you noted, the impact on the hospitals is of gravest concern. And not just, and I would just reemphasize this, not just because of hospitalizations that are directly related to COVID-19, but all of the other reasons that individuals may need urgent and emergent hospital care. And so this is something that we appreciate the suggestion, and we will certainly discuss that with the governor's office in terms of a consideration. In terms of testing and increasing testing for high-risk communities, communities of color, I think that is an important discussion. I know that some of that continues in Baltimore City and in Prince George's County, and I will find out more information about that and ensure that we do have more targeted ability to reach out to those communities. We've been in coordination with our Office of Minority Health and Health Disparities, as well as with the Governor's Office on community initiatives, and want to ensure that important messaging for those communities, because the testing sites are there, but making sure that they understand that, and that it is free testing, and and the importance of testing, and making sure to re-emphasize those messages are also part of what we are moving on. Thank you.
Next up, we have Senator Jason Gallion.
Yes, thank you. This question is for Dr. Chan. I had a constituent reached out to me this morning. They manage a nursing home, And the question they had was, why has the state decided to require nursing home staff to be tested twice a week before even one test from a hospital staff member is required? In their case, they had 4 residents with positive tests and 3 had a hospital visit, and then they tested positive. In each case, no one tested positive the week before.
We've got over 100.
So I appreciate that question. You know, the real reason is because as we look at the nursing home population, and you know, these are individuals who the main source of infection coming into that facility are staff, secondarily are visitors, and so that's why we're taking additional action on both. As I indicated earlier in my remarks, what we had been finding in the last month especially is that as the nursing homes were doing some of their routine and, you know, previously monthly testing or maybe even weekly testing of staff, that they would find one staff, which would then, staff member who was positive, that then triggered the universal testing of staff and residents, and then with that next round of testing, we would find 10, 15, 20 additional people, including residents who were positive. And so with the increase in the community spread, that is impacting the staff greatly, and these are the most vulnerable of the vulnerable, and we want to be as proactive as possible in identifying cases as quickly as we can among staff, to cohort them, to isolate them, and then identify residents who may be ill as well.
Sorry. We're gonna go longer because we know we have members. We don't know when the next meeting will take place. So, you know, we're going to continue on past 11, hopefully around 11:15. Speaker Pro Tem Sample Hughes.
Thank you, Madam Speaker and Senate President. Good morning to all. My question is regarding the number of homeless shelters that are now coming online. We want to ensure that they are equipped as well with the resources for testing. What I did find locally was that one of the shelters had a volunteer registered nurse to be able to equip themselves to do the testing, but that's not the case for all shelters. And I know you're probably going to say it's a local decision and have that connection, but I think as a state, we need to make sure that we have enough people from the health departments to help do those testings within the homeless shelters, because we're seeing that increase right now given the cold weather, and I just wanted to get an idea as to what is the plan and what is the best practice across the state. Thank you, Madam Speaker.
So, of course, you know, as you noted, you know, our local health departments are really working hard in so many different, you know, sectors, and, you know, with healthcare and detention centers, and including and with vulnerable populations in their own jurisdictions, and individuals who are homeless is also on the radar. I will discuss this further with our testing team as well, to better understand what plans they may have, and also with our health officers. You know, this is a vulnerable population, and we are certainly interested in working with those providers around the state, but this is something that would need to be coordinated at the local level.
Good question. Senator Lamb.
Yeah, thank you, Mr. President. Thank you for being here. I had a question about, you know, the next steps as we look at the current epidemic wave that we're seeing. The curve is continuing to go up, and my concern is, and I, you know, manage occupational health at one of the state's largest health systems. We're seeing cases go up within patients that are being employees that are calling out that are sick. it's reaching a point where we're seeing some of the same challenges that we saw back in March and April to that, excuse me, to that degree. The measures that were announced, do get us hopefully to a place where we can see that curve coming down, but yet we're not seeing anything in terms of plateauing of that curve, at least in the current trajectory. This is different than what we saw, I think, back in April and also back in August, where that did come down to a certain extent and gave us a little bit of breathing room. So my question then to you is, what are the next benchmarks we need to be looking at, and the metrics that keep an eye on that, if triggered, will lead to further restrictions and help protect our healthcare system, to give us that cushion to be able to account for not only the COVID patients, but also these other patients that may come in needing help at our hospitals as well. Because I think, if we don't have those next metrics and triggers in mind that might require further action, it could really make, March and April look like a walk in the park compared to what we're currently seeing in the current trajectory that we're on.
So thank you, Senator Lamb. The Maryland Department of Health and the governor's office and the governor himself and the lieutenant governor are looking at the metrics every single day. And the metrics, as we've shared with you, that are on our website, are some of the key metrics that we are managing. And, there is not a single metric, as you understand, that will trigger a specific set of actions, but it is a combination of case rates, looking at regional differences, as we noted earlier in the presentation, and also to a limited extent, because the contact tracing has some limitations, the data from contact tracing has some limitations, we're looking at contact tracing information. So, and then lastly, and very critically, is our hospital capacity overall. And so all of those things may trigger additional actions. We are not, some jurisdictions, as was noted by the speaker, they have taken some additional more restrictive measures, which is something that the counties have the authority to be able to do. And as needed, the governor will take more restrictive actions. We see the trajectory. We are continuing to urge Marylanders to take their own individual actions and to take this very, very seriously. This is not the flu. This is way more serious than the flu and is causing significant morbidity and mortality on our friends and our neighbors. To reiterate, we do not have a single metric that will trigger specific actions, but really a confluence of different metrics and indicators across the state.
Health and Government Operations Chair James Pendergrass.
Thank you, Madam Speaker. One of the metrics that I have been watching has been the case doubling rate. And 2 weeks ago, the doubling rate was occurring at 111 days. That means that it took 111 days for the cases in the state to double. Yesterday, the doubling rate was down to 58 days. So basically, we're doubling twice as fast as we were 2 weeks ago. I'm a little disappointed that we hadn't slowed down the spread by putting in place some activity limiting direction before yesterday, excuse me. And I'm wondering what the coordination between the health department and the governor is, because I would have thought that the health department might have noticed those kinds of alarming numbers and about a week ago might have begun clamping down a little bit on our activities. I think that guidance is a little late, and I think that shows up also in the hospital rates. If you could comment on that for me.
Thank you, Madam Chair. And we coordinate with the governor's office on a daily basis and even multiple times a day. This is one of the top priorities for the governor's office, as you are aware. And he is very involved in multiple aspects of the decisions to be made, and has been coordinating with his coronavirus recovery task force and advisors on that front, multiple times over the course of the last month to advise us, in addition to the experts that we have at the Maryland Department of Health. We continue to take a look at where we're headed. We see that, and we'll take additional measures as needed. So this is something that is really the top priority for all of us at this time.
So do you look at the doubling rate? And I'm trying to figure out why the steps that were taken yesterday weren't taken at least a week ago. I'm wondering if you have any comment on that.
So, we are looking at a number of different metrics, not just the doubling rate, but what the slope is of the increases in various metrics, including case rates and number of cases reported and hospitalizations, new admissions. And so the actions that we took last week, we built on this week. And so we'll continue to build on those actions as the metrics warrant.
Thank you.
Vice Chair of our Budget and Taxation Committee, Senator Jim Rosebat.
Thank you, Mr. President. I want to address this to Secretary Neal, who I share the President's and the Speaker's view has really done a terrific job over his entire career and in this role in particular. But I want to draw on that. Secretary Neal, last spring, this was all new to you, to us, to anybody who didn't work full-time in public health. What have you learned over this period that we should think about as we go forward over the next year? What worked better than you thought? What worked worse than you thought? Give us some advice. Thank you.
Thank you for that question. I think first of all, and this is not assessing blame, but I think public health generally over the years has been underfunded. And one of the things that got us off to a bumpy start is we did not have inventories of PPE in order to address the very early part of the pandemic. That's certainly one is being prepared. Second of all, we've done a number of desktop exercises throughout this pandemic. We just completed 2 on vaccine distribution. These are the kinds of things that you really ought to fire drill when you don't have a problem, so that you can be better prepared. I think we need to augment public health staff so that they are staffed up. We've been struggling staffing this up from the very beginning, and I'll shoehorn in a response to Senator Lamb, is that the metric that I'm watching is staffing, because we have enough beds. I think we'll have enough PPE, and we'll have enough medicine to start off, but you just can't manufacture people. And we're probably going to have to go into the medical schools and nursing homes and get temporary assignments so that they can extend the efforts of the staff that we have. You can't go without saying that the relationship with the state and federal government during this very crucial time had a number of impacts, not the least of which was being sort of cut off and made to fend for ourselves, and we were in very awkward situations where we were doing procurements and we were competing with the other 50 states. There was also an instance where, not here in Maryland, but another governor got his supply over in Asia confiscated by the federal government after he had ordered and paid for it. So there was a lot of unnecessary confusion and stress that detracted from a wholesome response. And it's still happening today. We're spending the CARES money like December 31st is the end of this. We all know it's not the end of this, but we do not have a continuation of funding. The states cannot respond to particularly this third wave without federal participation. And so I think we're a good 65 or 70 days or maybe 90 days of getting that resolved. So there are a number of things. I think the one thing that I think is really a miracle is the fact that we've got some functional vaccines that came about in months rather than years. I think if we look back on this, that's going to be something that shows that when people put their shoulder to the wheel, they can actually do some things. The other thing is that there are going to be some things that we learn from this. Telemedicine has taken a giant leap, not because we wanted to, but because we had to, because there was no other way for people to seek and get help. There are probably some other innovations that will probably stay with us just because we went through this very pressurized environment. Those are just a few off the top of my head. I've probably left out a number of them, but we've learned a lot, and I hope that knowledge doesn't go to waste, because 4 or 5 years from now, this was a 100-year storm, but there'll be lots of 10 and 20-year storms that'll be maybe not as bad as this, but will require a quick and fulsome response in order to protect the people of Maryland. So I hope we're up to it.
Thank you. Thank you, Mr. Secretary. Thank you, Madam Acting Deputy Secretary, for being here with us today. We look forward to ongoing conversations, particularly as we move into the next phase around vaccines and the distribution of vaccines, which is going to be our next Herculean challenge. And so I'm sure there will be follow-up on that front. And thank you both for your consistent efforts here and the ongoing conversation. We've got a tough road ahead, but it does feel like there is some light at the end of the tunnel on the vaccine front. And so we appreciate the ongoing collaboration.
Sure. Thank you, Mr. President.
Members, please make sure to check the hearing schedule. There's still a number of work groups happening. And so please be sure to check in on the Maryland General Assembly's website for additional meetings and be in touch. For those who we will not see, please have a very happy and very safe Thanksgiving. Take care, be well, love each other, and we will get through this. Madam Speaker?
Yes. In terms of final thoughts, I'd like to thank every employee at the Maryland Department of Health for their work during this crisis. We've heard from the department's leadership on a regular basis, and we appreciate their efforts, but we know that behind them are over 6,000 Marylanders who have been working long hours for months. And for that, we all thank them. We don't know when our next meeting will be. Only thing I can tell you is stay tuned. We all need to redouble our efforts and reach out to our districts and communicate the seriousness of this virus. Stay safe and wear a mask, and it is up to us to model responsible behavior. And everyone have a safe and happy Thanksgiving. Thank you.